It's a topic you might not think about very often, and that is bone and joint health.
Unfortunately, in children, it's common for them to have deformities. Dr. Bradley Lamm, a foot and ankle director of the Paley Institute, is with us today.
And the Paley Institute is world-renowned for what it does with children and adults with deformities, and we want to talk about that. But first, Dr. Lamm, as we say good morning to you, let's talk a little bit about bone and joint strength. How to get those bones and joints strong in kids and keep them strong in an aging population.
Yeah, it's challenging, a parent myself, just with taking care of the children. Good diet in our busy lives is very important. Good balanced diet, well hydrated children is important, and also to have them exercise, at school, after school, at home, and get them into these programs that allow their bones and joints to be healthy.
How common is it for children to have deformities?
Yeah, so there's deformities of various types. There's post-traumatic after injury deformities. At our center at the Paley Institute, we deal with very unique deformities, from the post-traumatic to the congenital deformities, either some sort of birth defects or bone tumor or other problems.
What are the most common limb deformities that you see?
So we see a lot of lower extremity and upper extremity shortness of bones or crooked bones. And these can be from various types of conditions. And patients travel all over the world to our center because of Dr. Paley and his contributions, his book and his writings, and his experience, as well as myself and my partners.
And I'm sure once upon a time you were born a certain way and that's the way you stayed. Now there's hope, and you guys actually do great things with various deformities, but it's a process, isn't it?
Yeah, very much a process. Sometimes there's limb salvage or preservation of limbs that we do. There's bone lengthenings with new technology.
That's amazing.
With internal rods that lengthen your leg with a magnetic device on the outside of your leg that Dr. Paley's been involved with developing these new technologies for these children.
It must be still amazing to you to see some of the changes you make in the lives of children and adults, but it's expensive. Does insurance cover this? And I know you've also got some other options for people who might be seeking a visit to you.
Yeah, so there's a lot of medical tourism at our center because of our unique technologies and treatment options and operations that we perform. We work with a lot of different foundations. There's the Paley Foundation, our foundation, which helps kids and children, and there's the Ronald McDonald type houses,
so
the
options.
Hackerman Pat's house that we have.
So if you don't feel you can afford it, there is hope.
Yes,
Don't
exactly.
give up.
Right.
Get in
Thank you
touch
so
with
much.
the Institute. Thank you so much.
All right, thank you.